What are varicose veins and what are the problems associated with varicose veins?
Varicose veins are swollen or enlarged veins which are commonly seen on the legs, extending from the ankle up to the knee or even up to the thigh. Generally, in the early stages, varicose veins do not have any other complaints associated. But as the condition progresses, you have cramping pains in the leg, which then progresses to skin thickening and pigmentation of the skin, dryness with itching in that area. Also, then you have small ulcers or wounds because of excessive itching. And finally, non-healing wounds develop, which can further lead to foot deformities.
Who are more likely to have varicose veins and why?
Any person who has a history of standing in one place for a long time, especially people with professions like being in the police, teachers, or even doctors who need to stand in one place, are more predisposed to have varicose veins. This is because if you stand at one place without moving, there is collection of blood in the veins of your leg. Now, these veins have small valves which prevent the blood from leaking back and ensure that the blood flows freely up to the heart. However, long standing or conditions like injuries or maybe increased pressure in your abdomen can cause leakage in these veins. Once there is leakage, that leads to more blood collection, that leads to expansion of the vein and further leads to varicose veins.
How do you diagnose varicose veins?
Varicose veins are diagnosed primarily on examination of the patient. We get to know by a few tests the vein which is involved, the extent of the damage as well as the sites of leakage. For confirmation of diagnosis and also for planning a treatment, there are a few additional tests. The most important of this is an ultrasound or a color Doppler of the leg. That lets us know exactly which vein is involved, the levels at which the problem is present and also the extent of the problem. Following this, we can further plan our management.
How do you treat varicose veins?
The main treatment of varicose veins is surgery. The affected vein has to be closed off and removed in the traditional process or closed off with a laser and sealed in laser treatment. However, if the patient has problems in the other veins of the leg or has some other abnormalities which do not allow surgery, we need to go for conservative management. That involves wearing compression stockings throughout the day, either up to the knee or up to the thigh, and also ensuring that you do not stand in one place without moving for an extended period. And finally, whenever you are sitting down or lying down, ensure that your leg is kept straight and slightly elevated to ensure that the blood drains from your leg towards your thigh and your heart.
What surgeries can be done for varicose veins?
The traditional surgery for varicose veins involved first thing tying of the vein and secondly removing the affected vein from the leg. This had a slightly higher time for recovery. Also, a few complications were associated with it. The other procedure is laser treatment, in which the vein does not need to be removed from the body. A small puncture is taken and the vein is shut down or sealed from inside without having to remove it.
Which anesthesia is used for laser treatment of varicose veins?
For a laser treatment of varicose veins, we can use local anesthesia only around the vein along with tumescent infiltration. Or if multiple veins need to be treated in the leg or both legs need to be treated, we can go for spinal or regional anesthesia.
What is the recovery time for laser treatment of varicose veins?
The recovery time in a laser treatment is very rapid. We generally keep you hospitalized for 1 day, after which we can discharge you. We recommend rest or light activities for a day or two, after which you can get back to your routine activities. Heavy activities or prolonged walking should be avoided for the first 15 days or so, but getting back to routine activities as soon as possible is recommended.
What are the chances of recurrence of varicose veins after laser treatment?
Laser treatment is very effective and it is as effective as traditional surgery in preventing varicose veins recurrence. So, if done properly, the chances of recurrence following a laser treatment are almost nil.
Are there any side effects of laser treatment?
The laser treatment is associated with very few side effects. The ones which are commonly seen are swelling along the course of the vein, which is very less or minimal, and also some bruising along the course of the vein is seen. Both these conditions are self-limiting and do not require any further management, and you can get back to your routine activities very fast.
What are the advantages of laser surgery over traditional surgery of varicose veins?
The traditional surgery of varicose veins involved making small cuts over the leg under anesthesia, tying off the affected vein and removing it from the body. That had slightly higher blood loss. Also, the swelling was more, and while removing the affected vein, there was chance of some damage to the surrounding structures. In laser treatment, we do not need to remove the vein. Small punctures are taken to allow the laser catheter to go inside the vein, and then the vein is sealed off from inside itself. And since the vein does not need to be removed, the chances of damage to the surrounding structures are removed. Finally, the swelling is minimal, and also the post-op complications are very few as compared to the traditional treatment, and the recovery is much faster.
Is laser surgery of varicose veins covered by most insurances in India?
Yes, laser ablation or endovenous ablation of varicose veins is covered under insurance as far as Indian companies are concerned.